Hi, I'm Dr. Steve Vargo, and this is episode 18 of Can I Ask You One Question, where we dive into the minds of industry experts and thought leaders, and we try to learn one thing from them that we can apply to our professional lives and maybe even our personal lives. And it's a real privilege to have Dr. William Miller with me, who is Emeritus Distinguished Professor of Psychology and Psychiatry at the University of New Mexico. He has been studying the psychology of change for 50 years, and he's best known for developing a communication method known as motivational interviewing. And he's also one of the authors of a book that was highly recommended to me, and I'll pass along that recommendation to really anyone in the healthcare, any healthcare professional. It's called Motivational Interviewing in Healthcare. So Dr. Miller, thank you so much for taking some time out of your day to share with us.
Pleasure.
So the topic of behavior change is something that I think we have a mutual interest in. And I learned early in my career that just educating people didn't always lead them to doing what we're recommending, like changing a behavior. Yet I think that's really where we make an impact as clinicians. We could educate people all day long, but the real way we make an impact is not just getting people to listen to us, but really to make the changes that improve their health or their well-being. So my question to you, based on your research, is what's the most effective approach to getting a patient to change a behavior?
Well, as you said, giving information and advice is part of our job, but it really matters how you do it. And I think maybe the most important thing is to realize when you're talking to a patient about doing something or making some kind of change, you can bet they're ambivalent about it. Most of us are comfortable with how we're doing things now, and thinking about doing something else, you can see some pros and some cons to it. So you're talking to a person who's probably ambivalent about doing it or about making the change. What's important to realize here is what happens if you argue for change. If you champion the side of the ambivalence that says this is important and you need to do this, very predictable response is the patient argues against it and says, no, I don't need to do that, or I don't think so, or I'm not so sure. All they're doing is giving you the other side of their own ambivalence. And that might be sort of therapeutic, except for the fact that most of us tend to believe ourselves. And so if I hear myself arguing against change, and I hear you arguing for change, I'm likely to talk myself out of changing. I'm likely to convince myself that it's not something that I want to do. So the most common response to at least unsolicited advice is either not to do it or to do the opposite, even if you agree with the advice, which is just an interesting human phenomenon. We don't like being on the receiving end of advice. It kind of gives you a one-down, subservient feeling. And so just flat out giving advice, the expected response would be that the person won't do it. So how you give the advice really matters. And it has to do with honoring the person's autonomy. For example, asking permission first, a very simple thing. What would you be interested in hearing some about? Or is it okay with you if I tell you a concern that I have here with your health? Just the asking of permission acknowledges the person's right to decide that they don't want to do what you have to say. You can even say that directly with something like, this may or may not concern you, or I don't know whether this will matter to you or not. You're giving them permission to disregard what you're going to say. And ironically, the effect of that is they're more likely to hear it and follow it and do it. Another thing that seems to help is to give a person several options. So rather than just one thing that you're telling them to do, say, well, there are a variety of ways in which you could do this. And is it okay if I tell you what some of the options are? So it's that collaborative kind of conversation where you're recognizing that the person you're talking to, they're the one that gets to make the change, and they're ambivalent about it. If you push for change, they will push back, and the net result of that is they're unlikely to do it. Whereas if you find out from them what they would like about it, why they might like to do it, how they think they might go about doing it, why it's important to them, and you have them voice those motivations for change, they're much more likely to do it.
Yeah, it's interesting. And I know you have a more recent book, On Second Thought, that takes a lot of what you talk about, but applies it more to, I'll let you expand on that, but the general public. It's really interesting to me, that particular topic of when you push, people's tendency is to push back, even when you're just trying to help them. But yet when you explore, and I know your book goes into this, when you explore their reasons for wanting to do something, and then you support their reasons, so often you almost have to discover this on your own to believe it, because we're not really taught that in school. We're taught, we're the doctor, I'm going to tell you what to do. But then we seem surprised as a young doctor when people don't always follow everything we want them to do. But just being able to understand and connect with somebody on their reasons, it really is a game changer in healthcare.
It makes a big difference, and you can pretty immediately see your patients responding in a different way when you take this approach rather than telling them what's wrong with them and what to do. So it blends with your expertise. It's just recognizing that your patient also has expertise. They know more about themselves than anybody else does. Mm-hmm. And if what you're asking is to begin to integrate a change into their lifestyle, you need their help as well. But ambivalence is a really fascinating human phenomenon. So I wrote this other book you mentioned just for people in general to understand how ambivalence works. We talk about it coming in 4 different flavors and how you can get stuck, and also how to get through ambivalence. And I wound up concluding ambivalence is a virtue. Sometimes we think of it as procrastination or something undesirable or uncomfortable, but it doesn't have to be, actually. And every day we experience ambivalence. And I think understanding what you're experiencing and how to deal with that in yourself and others can be very helpful.
Well, Dr. Miller, thank you so much for your time. Where can people find out more about you and your books?
I have a website, which is wrmiller.net. No, it's williamrmiller.net. And that's a place you can find out more about my work. And of course, the books are widely available.
Great. Awesome. Thank you so much. And thanks for listening. And you can find the show notes for this episode and all other episodes at drstevevargo.com. Thanks again. Thanks, Dr. Miller. And we'll see you next time.